Joel Dunning, and I'm here at STS 2024 with Leah Backhus. Thank you so much for coming. It's great to see you. And yeah, we've known each other for a little while, trying to email back and forth, but it's great to meet you in person. And yeah, thanks for coming. So you're just about to give a talk at a session all about cardiothoracic training. And I think yours is titled, Is the Pipeline Leaking? Which I guess means there might be a problem. So maybe if you could give us a little early hints of what you'll be talking about at your session.
Thank you, Dr. Dunning. This is a nice opportunity. I appreciate the invitation to come and talk to you. Is the pipeline leaking? Yes, it is, but also we need more water in the pipe, so to speak. And in fact, my first slide says, like, do we have a problem? So we do have a problem in that there is not a lot of diversity when it comes to our cardiothoracic surgery workforce by any measure. You pick the measure, it's not very diverse. So it's pretty homogenous, and that hasn't changed very much. It has changed some, but certainly not to the degree that it should in the time that we've been at least monitoring and looking at it. So we can do better. You know, I kind of skipped the part about why diversity matters, why it's important, but of course that, you know, so I'm coming from a position of everyone's already bought into this, that in order to be excellent as a specialty, as an organization, you have to have a diverse talent pool. Like I said, by any measure that you want to, but the diversity breeds the excellence because it's going to bring in lots of perspectives, etc. So sort of already starting from that ground rule, and yeah, we do have a problem.
And just from your own experience, do you think you've seen those barriers as you've come through the ranks to be where you are today?
I think I've been incredibly fortunate, honestly. I certainly have had a different lived experience probably than many of my colleagues in terms of growing up in CT surgery. But I think I've weathered them okay, and it's to no small credit to my mentors and sponsors and the people around me and folks who recognize something in me that I may not have recognized in myself. So I think that it's, yes, I've benefited tremendously from it, but I also know that it's there in terms of what the barriers are. I think the harder part is not so much in cataloging what the barriers are, but trying to get people to do some of the things that we know are best practices that will actually level the playing field.
Yeah. So let's talk specifics. You know, what could, if a surgeon's watching this right now, you know, what can we actually do to try and right this wrong, really? What can we do today?
Well, one of the things that I think we can do is recognize our position of influence, right? That there are many people that are trying to be where we are. No matter where you are, you're in the community, you're in academia, it doesn't matter. There are many people who are trying to be where you are. So how can they do that? You've got to use your visibility to the advantage of the specialty and try to recognize talent where it is. I think that we holistically have to evolve to a point where we can recognize a diverse set of criteria for excellence. That is not simply your pedigree in terms of grades, numbers, school, some of the historical metrics that we use to measure people by. We've got to get better about recognizing that there are lots of different ways that one can be excellent. And in recognizing those ways, that's going to add value to the people that we produce in the pipeline. So I think we can all do a better job of that. See the people, recognize the talent that's out there, and do what we can to try to cultivate it.
And I guess you might agree that actually we're quite bad in cardiothoracics as compared to other specialties, would you say? Would you say there are other surgical and certainly non-surgical specialties that are way ahead of us, aren't they? You know, what do you think they've done that we haven't?
I'd say the ones that are way ahead of us are ones that you can fit into gender norms. You know, peds, OB-GYN, they're way ahead for very obvious reasons with regards to gender. There are lots of other barriers with regards to race and ethnicity, which would be kind of the next bar, if you will. And then of course there are other aspects of diversity that really we can't even measure yet, because we can only measure the things that are really visible and that people are willing to disclose. And there are lots more of diverse people who have hidden diversity, if you will, air quotes, that we don't see and that they may not be comfortable sharing and whatnot, but they're probably uncomfortable sharing it because we make it so weird and nobody wants to be that only one.
So we've actually just recently done a little interview with the Thoracic Surgery Medical Students Association, and they've been working really hard to try and pair up people who are interested in cardiothoracic surgery with people like us, like surgeons. So, and I guess that is one way, is actually to open your doors to allow these people into your ORs to watch what you do. So I'm sure you'd agree that people, maybe one thing they could do today is maybe go out to a school that, maybe not the best school in the world, and just invite them to come and see what we do, because they don't even see what we do they?
Absolutely. Exposure is everything. And even if you look just one click down at medical school and general surgery, the general surgery residents don't rotate with cardiothoracic surgery by and large. It used to be that you had mandatory rotations, you got great exposure, and that bred a whole, group of great CT surgeons. And it's dwindled down and down and down as general surgery has gotten more and more complex, and they've had to incorporate a lot more experiences and whatnot, and aren't necessarily interested in creating pre-CT surgeons, right? They're interested in making good general surgeons, and so that's definitely taken a backseat. Similarly for medical students, though, they've gotten less and less systematically, less and less exposure to our specialty, and that's a problem. It's really hard to dream up what you haven't seen, So yeah, to your point, if you're able to get out there and make our specialty more visible, more approachable, then that's going to pay dividends big time.
Do you think in America you could end up having a shortage of thoracic surgeons? I think in the UK we're thinking we're going to have a shortage in the next 5 years, especially with lung cancer screening. Do you think that's a realistic thing in America? Do you think you might end up short of surgeons?
I do think so, and by all calculations, I can't remember when's the last projection that was done, but say within the past 10 years, that all projections moving things out, accounting for attrition, retirement, things like that, and the current training rates, yes, we're going to have a workforce shortage.
Yeah, so you're not going to be able to retire, are you? You're going to have to work till you collapse. This is serious, isn't it?
I know, and I think honestly, maybe that's part of the lack of enthusiasm to change things, is that maybe surgeons who are currently practicing in the status quo don't see it as such a downside. Oh, I get to do more cases for me, right? And so maybe they're not incentivized to figure out a way to help mitigate what's on the horizon. But we can't do it all.
Yeah, no, it's important, isn't it? Yeah. So yeah, it's totally right. So I can't wait for your session. Hopefully it'll make a few people stand up and think about it, because we need the best talent, and we need a good supply of thoracic surgeons for the next generation, don't we?
We absolutely do. We've got to do a better job of being good stewards of the specialty. So.
Yeah, well, thank you so much for coming to talk to us, Leah. It's been an absolute pleasure, and thank you from everyone from CTSNet. So
thanks so much. Have a good meeting.